Hello, myself Dr. Akshay Salgar, Associate Professor, Department of Community Medicine, Symbiosis Medical College for Women, Pune. Since last 1.5 years, the world is going through the pandemic of coronavirus disease. To control this situation of coronavirus disease, all of us should know the various aspects of the disease. Today, I am going to talk regarding COVID-19 health and safety. What is coronavirus? Coronavirus is a newly discovered virus. Coronavirus disease is an infectious disease caused by a newly discovered coronavirus. The name refers to the unique appearance of the virus under an electron microscope as round particles with a rim of projections resembling the solar corona. Coronavirus derived from the Latin word corona, meaning crown or halo. In December 2019, China reported an outbreak of pneumonia of unknown causes in Wuhan city, the capital city of Hubei province. The World Health Organization, that is WHO, named the resultant disease as coronavirus disease, or we can say COVID-19, and as on March 11, 2020 declared COVID-19 as a pandemic. Is COVID-19 the same as SARS? At the beginning, many scientists thought coronavirus disease and SARS is one and the same, but the answer to this question is no. The virus that causes COVID-19 and the one that caused the outbreak of severe acute respiratory syndrome SARS in 2003 are related to each other genetically, but the diseases they cause are quite different. SARS was more deadly, but much less infectious than COVID-19. COVID-19 can spread very fastly from one person to another. A single patient of COVID-19 can transmit a disease to 4 to 5 persons. There has been no outbreak of SARS anywhere in the world since 2003. How does coronavirus spread? Coronavirus spreads majorly through droplet of the person to person, direct person to person respiratory transmission via respiratory particles. Viruses release in the respiratory secretions when a person with infection, cough, sneezes or talks can infect another person if it is inhaled or makes direct contact with the mucous membranes. Infection might also occur if a person's hands are contaminated by these secretions or by touching contaminated surfaces and then they touch their eyes, nose or mouth. Touching contaminated surfaces and then touching their eyes, nose, mouth, although contaminated, are not thought to be a major route of transmission. Coronaviruses primarily infect the upper respiratory tract and gastrointestinal tract. Coronaviruses can be detected in stools of COVID-19 patients. Although virus particles have been detected in stool samples of both symptomatic and asymptomatic patients, even after recovery of COVID-19 patients, the risk of fecal-oral transmission is unclear.
The COVID-19 virus spreads mainly between people in close contact with each other. It spreads most easily in crowded settings, closed spaces with poor ventilation, or through prolonged contact with an infected person. This is because, as a person infected with the COVID-19 virus breathes, talks, coughs, or sneezes, liquid particles of various sizes are expelled into the air. Larger particles are called droplets. Smaller particles are called aerosols. You can contract the virus if infected particles come into contact with your eyes, nose, or mouth. Whether you are inside or outside, always maintain a physical distance of at least 1 meter from others. When you are in an enclosed or poorly ventilated space, the virus can spread more easily. In these conditions, aerosols can remain suspended in the air or travel farther than 1 meter. When you are inside, make sure to stay at least 1 meter from others. Wear a mask. Open a window to improve ventilation, and limit your time spent in these settings. To protect yourself and others, always follow these 6 precautions.
How to self-check symptoms for COVID-19? If you have muscle ache not related to any other medical conditions or another specific activity, example, physical exercise. Do you feel like you have a temperature of greater than 100 °F? Do you have sore throat not related to another medical conditions like other allergies? Do you have a new or worsening cough that is not related to another medical condition? Example, if you have a previous tuberculosis. Do you have shortness of breath that is not attributable to another medical condition like cardiovascular disease or previous myocardial infarction? Do you have recent, that is less than 5 days, loss of smell and taste? Do you have a new onset of vomiting or diarrhea not related to another medical condition? Do you have recent close contact with someone who has tested positive for COVID-19? These are the various aspects you have to ask yourself to self-check you have COVID-19 symptoms or not. What should I do if I have COVID-19 symptoms? If you or any of your family members have any symptoms suggestive of COVID-19, what we talked previously, call your healthcare provider or COVID-19 hotline for instructions and find out when and where to get a test. Stay at home for 14 days from others and monitor your health. If you have shortness of breath or pain or pressure in the chest, seek medical attention at a health facility immediately. Call your healthcare provider or hotline in advance for direction to right health facility. If you live in an area with malaria or dengue fever, seek medical care if you have a fever. If local guidance recommends visiting a medical center for testing, assessment or isolation, wear a medical mask while traveling and from the facility and during medical care. Also keep at least 1 meter distance from the other people and avoid touching surfaces with your hands. This applies to adults and children. Do not panic about the disease. It may not help you, but worsen the disease progress. And the most important thing, do not believe in any rumors. Most people infected with COVID-19 viruses will experience mild to moderate respiratory illness and recover without requiring any special treatment. Older people, those who are above 60 years, and those with underlying previous medical problems like cardiovascular diseases, diabetes, chronic respiratory disease, cancer, are more likely to develop serious illnesses. Among those who develop symptoms, most, that is nearly about 80%, recover from the disease without needing hospital treatment. About 50% becomes seriously ill and require oxygen, and 5% who are critically ill need intensive care. Complications leading to death may include respiratory failure, acute respiratory distress syndrome, that is ARDS, sepsis, septic shock, thromboembolism, and multi-organ failure, including injury of the heart, liver, or kidneys. In rare situations, children can develop a severe inflammatory syndrome a few weeks after infection. So, better cautious with the children. However, anyone can get sick with COVID-19 and become seriously ill or die at any age. The best way to prevent and slow down the transmission is to be well informed about the COVID-19 virus, the disease it causes and how it spreads. Protect yourself and others from infection by washing your hands, using alcohol-based sanitizer, frequently not touching your face or mouth or nose. COVID-19 virus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. So, it is important that you also practice respiratory etiquettes, for example, coughing in a flexed elbow or using a handkerchief.
Every day, we make moves like we do in the game of chess to checkmate COVID-19. Moves like clean your hands frequently, cough or sneeze into your elbow, wear a mask, keep your distance at least 1 meter, and open a window if possible. Each move is important and should be played as often as possible. Make your moves. Checkmate COVID-19.
What do we do not know? Many facts about COVID-19 are still not known. Scientists are working to learn more about these variants, and more studies are needed to understand how widely these new variants have spread, how the disease caused by these new variants differs from the disease caused by the other variants that are currently circulating, how these variants may affect existing therapies, vaccines, and tests.
When you hear about variants, variants of concern, variants of interest, mutations, double or triple mutations. What does that mean? And what action does the public need to take to protect themselves? Hello and welcome to Science in 5. I'm Vismita Gupta Smith. Giving us an update on variants today is Dr. Maria Van Kerkhove. Maria, give us an update on the variants that are circulating right now.
Thanks for having me back. There are several virus variants that WHO is tracking around the world. The SARS-CoV-2 virus, the virus that causes COVID-19, is evolving. This is natural evolution, and the virus is expected to change the more the virus circulates around. Currently, there are 4 variants of concern that WHO is tracking around the world. The B.1.1.7, which was first identified in the United Kingdom, the B.1.351, which was first identified in South Africa, the P1 variant, which was first identified in Japan from travelers from Brazil, and now we've recently classified the B.1.617, which is first identified in India. Now, it's really important that you look at the latest information from WHO because this is a fast changing situation. The latest information we have on all of our variants of interest and variants of concern that we are tracking are released on our website in our weekly epidemiologic sitrep.
Maria, how does WHO classify a variant as a variant of interest or a variant of concern?
Variants of interest have properties, have mutations that have been identified that need further study. Variants of concern have demonstrated changes. For example, you may have increased transmissibility, there may be a change in disease presentation or severity, or there may be a change in our ability to control the virus with public health and social measures, or the use of diagnostics, therapeutics, and vaccines. So the recent variant of concern, the B.1.617, for example, has demonstrated increased transmissibility, and this is why this has been classified as the variant of concern. So you'll notice when I said a variant of concern, I named it by a number, for example, B.1.617, and I didn't call it a country name variant. It's really important that we don't do that. We don't say country X variant because that really adds a stigma associated with these variants. And it's important that surveillance is occurring around the world and we detect these variants very quickly. The information is shared so that it can be analyzed so that we understand the potential implications once they are identified.
What does this mean for the public?
It means that we need to do everything that we can to prevent infections and reduce the spread of the SARS-CoV-2 virus, whether it's a virus variant, a variant of interest, or a variant of concern or not. The SARS-CoV-2 virus can infect us and it can spread between people. So it means take all of the measures that you can to reduce your exposure and the possibility of you getting infected. It means physical distancing, avoiding crowded spaces, spending more time outdoors than indoors. If you are indoors, make sure that there's good ventilation. It's about having clean hands and wearing a mask properly over your nose and your mouth, practicing respiratory etiquette, being well informed, and no matter what you do, know what your risk is and take steps to lower your risk. And lastly, when it's your turn, get vaccinated. There are many studies underway studying the properties of each of these variants of concern in terms of transmissibility, severity, and impact on diagnostics, therapeutics, and vaccines. So far, from the information that we have, from the studies that are underway, and the results that are available, the public health and social measures, the diagnostics, therapeutics, and vaccines do work against these virus variants. We are learning every day, and as soon as we have more information, we will share this with you.
Thank you, Maria. That was Dr. Maria Van Kerkhove giving us an update on virus variants. Until next time, then, stay safe, stay healthy, and stick with science.
What actually does it mean to us? Public health officials are studying these variants quickly to learn more about how to control their spread. They want to understand whether the variants spread more easily from person to person, cause milder or more severe disease in people, are detected by currently available viral test, respond to medicines currently being used to treat people for COVID-19, change the effectiveness of COVID-19 vaccines, what we are using now. What is the difference between COVID-19 and seasonal allergies? Many people have this question. What actually is the difference? The difference is that COVID-19 is a contagious respiratory illness caused by infection with a coronavirus, also called as SARS-CoV-2. In COVID-19, fever is the major symptom, which we do not see in any allergic condition.
Confused or worried about symptoms during the COVID-19 pandemic? If you only have a runny nose or are sneezing, you may have a cold or allergies. Have you lost your sense of taste or smell? Are you experiencing shortness of breath? These are common symptoms of COVID-19. Coughing, fatigue and fever are all symptoms of both flu and COVID-19. If you have a temperature above 38 degrees Celsius or 100.4 degrees Fahrenheit, call your local healthcare provider or hotline for medical advice and ask whether you need a COVID-19 test. If you have any COVID-19 symptoms or are waiting for test results, stay home and isolate from other members of your household. Drink fluids and eat well. Always wear a mask if you're in the same room as others. If you test positive for COVID-19, follow your healthcare provider's advice. If at any time you experience a danger sign like difficulty breathing, chest pain, confusion, loss of speech or mobility, don't wait. Seek medical care immediately. Remember, you can prevent colds, flu and COVID-19 by following a few basic precautions. Stay safe and protect each other. We're in this together. Know your risk, lower your risk.
Is there anything I should not do? The following measures each and everyone should follow for effective prevention from COVID-19. These things are harmful for you, like smoking, wearing multiple masks, taking antibiotics without consulting your physician. If you are taking antibiotics without taking a prescription from your physician, it will lead to antibiotic resistance in future, which may be dangerous for you as well as the community. In case if you have fever, cough and difficulty in breathing, seek medical care early to reduce the risk of developing a more severe infection, and be sure to share your medical history and recent travel history with your physician and healthcare provider. Arogya Setu is one such app. Arogya Setu is an Indian COVID-19 tracing app with syndromic mapping and self-assessment. It is a digital service, primarily a mobile application developed by National Informatics Center under the Ministry of Electronics and Information Technology. The stated purpose of this application is to spread awareness of COVID-19 and to connect essential COVID-19 related health services to the people of India. This app augments the initiatives of the Department of Health to contain COVID-19 and share best practices and advisories. It is a tracking app which uses the smartphone's GPS and Bluetooth to track COVID-19 cases. The app is available for Android and iOS mobile operating systems. With Bluetooth, it tries to determine the risk if one has been near within 6 feet of a COVID-19 infected person by scanning through a database of known cases across India. Using location information, it determines whether the location one is in belongs to one of the infected areas based on the data available.
Each and every problem has a solution. However, since COVID 19 has no definitive cure yet, the only solution to this mammoth problem is to control its spread. Arogya Setu, a powerful yet simple healthcare mobile app, can help us achieve exactly that and more. The app keeps track of the people the user comes in contact with, anonymously via Bluetooth and GPS, creating a secure and encrypted real-time social graph of the person. Only when a person tests positive and reports the case, the Government of India can fetch his real-time social graph for the last 14 days and inform those the infected person came in contact with, without sharing personal details. Helping all at-risk individuals seek immediate medical help and practice self-quarantine, saving time and saving the spread of the virus. The app will also help with risk self-assessment and enable the Government of India to reach millions of citizens to share important health notices and updates. The app personalizes pages and messages for different professional groups. Every individual's privacy is important. We keep the data absolutely secure and highly encrypted. The Government of India alone will access it and only for administering medical interventions. We must flatten the curve, and Arogya Setu gives us that chance. Arogya Setu can help us fight coronavirus right now and then serve the nation as a critical healthcare management app. The time is now for Arogya Setu because मैं सुरक्षित, हम सुरक्षित, भारत सुरक्षित.
What are the various things what we have to do during COVID-19 and going to workplaces? Can COVID-19 be transmitted at workplace? Yes. COVID-19 spreads primarily through respiratory droplets or contact with contaminated surfaces. Exposure can occur at workplace, while traveling to work, during work-related travel to an area with local community transmission, as well as on the way to and from the workplace. What is the risk of contacting COVID-19 in workplace? The risk of exposure to COVID-19 in the workplace depends upon the likelihood of coming within 1 meter of the others, in having frequent physical contact with people who may be infected with COVID-19, and through contact with contaminated surfaces and objects. How can people assess the risk for exposure to COVID-19 in their workplace and plan for preventive measures? Managers, with the support of an occupational health and safety advisor, should carry out rapid risk assessment to determine the possibility of exposure risk in order to put in place preventive measures. This should be done for each specific work setting and each job. Low exposure risk, where the jobs or work without frequent close contact with the general public or others is there. Workers in this group have minimal occupational contact with the public and other co-workers. Examples of such jobs may include remote workers like working from home, office workers without frequent close contact with others, and workers providing teleservices. Medium exposure risk, the jobs or tasks with close frequent contact with the general public or others. This risk level may apply to workers who have frequent and close contact with the people in high population density with environments. Example, food markets, bus stations, public transport and other work activities, where physical distancing of at least 1 meter may be difficult to observe, or tasks that require close and frequent contact between co-workers. This may also include frequent contact with people returning from areas with community transmission. Example of such jobs may include frontline workers in retail, home deliveries, accommodation, construction, police and security, public transport, water and sanitation. High exposure risk. Jobs or tasks with close contact with people who may be more likely to have COVID-19 as well as contact with objects and surfaces possibly contaminated with the virus. Example, including transport people known or suspected to have COVID-19 without separation between the driver and the passengers. Providing domestic services or home care for people with COVID-19 and having contact with the deceased who were known or suspected of having COVID-19 at the time of their death. Jobs that may fall under this category include domestic workers, social care workers, personal transport and home delivery. Home repair technicians like plumbers, electricians who have to provide services in the homes of people with COVID-19. Who should carry out the workplace risk assessment? Employers and managers in the consultation with workers should carry out and regular update this risk assessment for work related exposure to COVID-19, preferably with support of occupational health services. What are the considerations for the workplace risk assessment? For each risk assessment, consider the environment, the task, the threat, resources available such as personal protective equipment and the feasibility of protective measures. The risk assessment should also extend to collective accommodation provided by the employer for workers such as dormitories, essential public services such as security and police, food retail, accommodation, public transport, deliveries, water and sanitation and other frontline workers may at an increased risk of exposure to occupational hazards for health and safety. Workers who may be at higher risk of developing severe COVID-19 illness because of age or pre-existing medical conditions should be considered in the risk assessment for individuals. How should employers decide when to open, close or reopen the workplaces and or suspend downscale work activities? Deciding to close or reopen a workplace or suspend or downscale work activities should rely on the risk assessment, the capacity to put in place protective measure and the level of compliance and recommendations of national authorities. What key measures to protect against COVID-19 should be made in all workplaces? Measures to prevent transmission of COVID-19 that apply to all workplaces and all people at the workplace include frequent hand washing or disinfection with alcohol based rub, sanitizers, respiratory hygiene such as covering coughs, physical distancing of at least 1 meter or more according to the national recommendations, wearing of mask where distancing is not possible, regular environmental cleaning and disinfection and limiting unnecessary travel. Clear policies and messages, training and education for staff and managers to increase the awareness of COVID-19 are essential. The management of people with COVID-19 or their contacts is also critical. Example, requiring workers who are unwell or who develop symptoms to stay at home, self-isolate and contact a medical professional or the local COVID-19 information line for advising on testing and referral. What additional measures should be taken at workplaces and for jobs at medium risk? In work areas at high risk, assess the possibility of suspending the activity, enhance regular hand hygiene, provide medical masks, disposable gowns, gloves and eye protection for workers who must work in the homes of people who are suspected or known to have COVID-19. Train workers in infection prevention and control practices and use of personal protective equipment. Avoid assigning tasks with high risk to workers who have pre-existing medical conditions like pregnant or older than 60 years of age. What additional measures should be taken at workplaces and for jobs at high risk? In work areas at high risk, assess the possibility of suspending the activity, enhance regular hand hygiene, provide medical masks, disposable gowns, gloves and eye protection for workers who must work in the homes of people who are suspected or known to have COVID-19. Train workers in infection prevention and control practices. Use of personal protective equipments. Avoid assigning tasks with high risk to workers who have pre-existing medical conditions like pregnant or older than 60 years of age. What should be taken into consideration when setting a physical distance at workplace? WHO recommends keeping a physical distance of at least 1 meter between each person in all settings including workplaces, because transmission can occur in crowded workplaces. WHO recommends providing sufficient space, at least 10 square meter for every worker. National recommendations for physical distancing may require greater physical distance and should be complied in order to support compliance with national or local authorities. Implement physical distancing guidelines in a way that is practical and feasible in the context of work tasks and which is acceptable to both workers and the employers. Stimulate workers to comply with physical distancing norms also at events outside the workplace, in the community and in the dormitories. Risk assessment and consultation between employers and workers is very important for setting up and implementing physical distancing measures at the workplace. This may require modification of workstations, changing the use of common spaces and transport vehicles, staggered work shifts, split teams and other measures to reduce social mixing at the workplace. If physical distancing measures at the workplace are not feasible for the specific work task, consider whether the work can be suspended, and if this is not possible, apply additional protective measures such as the use of screens, sneeze guards, face masks, enhanced hand washing, ventilation and disinfection. Physical distancing alone cannot prevent COVID-19 transmission. It is important that it is combined with other public health measures such as hand and respiratory hygiene, environmental cleanup and disinfection of commonly touched surfaces and objects, ventilation, wearing face masks and a policy of staying at home if unwell. What are the rights, duties and responsibilities of employers? Employers, workers and their organizations should collaborate with health authorities to prevent and control COVID-19. Cooperation between management and workers and their representatives is essential for workplace related preventive measures. International labor standards on the rights and responsibilities of workers and employers in occupational safety and health should be fully respected. Employers, in consultation with workers and their representatives, should plan and implement measures to prevent and mitigate COVID-19 at workplace through engineering and administrative controls and provide personal protective equipment and clothing according to the risk assessment. Such measures should not involve any expenditure on the part of the workers. Special measures are needed to protect workers at high risk of developing severe diseases, such as those aged 60 and over or with underlying medical conditions. Upon recommendation of the occupational health services, workers in the informal economy and digital labor platforms, those in small enterprises, domestic and migrant workers should not be left behind in the protection of their health and safety at work and their livelihood. There should be no social stigma or discrimination at the workplace for any reason, including access to information and protection from COVID-19, occupational health services and mental health and psychological support. If COVID-19 is contracted through occupational exposure, it could be considered an occupational disease, and if so, determined should be reported and compensated according to the international labor standards and the national schemes for employment injury benefits. What are the rights, duties and responsibilities of workers? Workers are responsible to follow the measures for occupational safety and health and infection prevention and control established for their workplace and to participate in training provided by the employer. Workers should report to their supervisor in any situation which may present an imminent and serious danger to their life or health. Workers have the right to remove themselves from any work situation that they have responsible or reasonable justification to believe presents an imminent and serious danger to their life or health and should be protected from any undue consequences as a result of exercising this right. How can workplaces plan for prevention and mitigation of COVID-19? Workplace should develop action plans to prevent and mitigate COVID-19 as a part of business continuity plan and according to the results of the risk assessments and epidemiological situation. The action plan and preventive measures should be regularly monitored and updated. Workers and their representatives should be consulted and should participate in the development, monitoring and updating of workplace COVID-19. It is very important to monitor the effectiveness of preventive measures and the compliance of workers, visitors, customers, clients and subcontractors with the measures. The plans should be updated when someone with known or suspected COVID-19 is at the workplace. Can the return to the workplace be immediate after public measures are lifted? The return to the work premises should be carefully planned with preventive measures put in place according to their risk assessment of the different jobs and work tasks. All possible risks for safety and health should be assessed, such as risk resulting from reduced maintenance of machines and facilities during the closure period. If a return to work is rushed and not done in a phased manner and cautious manner, it puts lives at risk and threatens to undetermined efforts to restore social and economic activity. Does WHO recommend thermal testing of people entering a workplace? Yes. Temperature screening cannot detect all cases of COVID-19 since infected individuals may not have fever early in the course of infection or illness, such as during the incubation period or just before other symptoms. Even though they may be already infectious, some people may reduce fever with few reducing medication if they are concerned about the possible consequences of not coming to work. Relying on temperature screening alone will not stop the spread of COVID-19 at work. Thermal screening at the workplace can be considered as a part of a package of measures to prevent and control COVID-19 at the workplace. Workers should be encouraged to self-monitor their health, possibly with the use of questionnaires and to take their own temperature regularly at home. Workplaces should adopt stay at home if unwell and flexible sick leave policies to discourage workers with symptoms consistent with COVID-19 from coming to the workplaces. Does WHO recommend workers wear masks at the workplace, office or others? If yes, what type of mask they should wear? Wearing masks depends on the risk assessment. For jobs and tasks that carry a medium or high risk for people aged 60 and older, and for those who underlying health conditions, a medical mask and other personal protective equipment should be provided. Fabric masks or masks covering are currently recommended for younger people and those with no symptoms where physical distancing is not achievable. This prevents the spread of virus from wearer who could have COVID-19 but no symptoms to others. The policy on wearing a mask or face covering in low risk workplaces should be in line with national or local guidelines. Masks may carry some risk if not used properly.
There is no one head size. Hats come in small, medium, and large. Eyeglasses are fitted. Just like with a hat or glasses, your mask should also fit your face, because any gap allows the virus to escape. No matter how good your mask is at filtering the virus, if it doesn't fit, it doesn't work. There are plenty of ways to get a good fit. Look for masks that come in different sizes and find the one that fits your face. Adjust the straps around your ears or head for a snug fit. Look for a mask with a flexible nosepiece. Here's what to check. No gaps at the sides, no gaps at the nose, and no gaps around the chin. Now, breathe normally. Is it comfortable? If not, find another one. If it is comfortable, make sure when you blow hard, the air stays in your mask. Stay safe, close the gaps. And don't forget, it's not just about masks. Get vaccinated when it's your turn. Keep your distance, clean your hands, cover your cough with a bent elbow or tissue, and open a window.
A fabric mask acts as a barrier to prevent the spread of the virus. It must be used correctly and always combined with other measures to protect yourself and everyone else. When wearing a fabric mask, clean your hands before putting it on. Inspect the mask and do not use it if it is damaged or dirty. Cover your mouth, nose and chin. Adjust the mask to your face, leaving no gaps on the sides. Avoid touching the mask while wearing it. Change your mask once it gets dirty or wet. To take off the mask, clean your hands first. Remove it by the straps behind the head or ears without touching the front of the mask. As you remove the mask, pull it away from your face. Clean your hands after taking off any mask. If you need to reuse a fabric mask, store it in a clean, resealable bag. Hold the mask at the elastic ends when removing it from the bag and make sure it is not dirty or wet before using it again. Wash fabric masks in soap or detergent, preferably with hot water, at least once a day. Make sure you have your own mask and do not share it with others. When wearing a mask, make sure you know how to put it on, use it, remove it, and discard it or wash it correctly. Remember that a mask alone cannot protect you. When wearing a mask, continue to adopt other measures to prevent the spread of the virus. Stay at least 1 meter away from others. Clean your hands frequently and thoroughly, and avoid touching your face and mask. Stay safe, and let's all prevent the spread of COVID-19.
Are there any directives on office ventilation and air conditioning use? There should be fresh, clean air in all workplaces for jobs and work tasks at medium or high risk of exposure. WHO recommends an increased ventilation rate to natural aeration or artificial ventilation, preferably without recirculation of the air. In case of air recirculation, filters should be cleaned regularly. What mental health and psychological support should be provided to workers during COVID-19? COVID-19 is associated with a range of concerns such as fear of falling ill and dying, of being socially excluded, placed in quarantine, or losing a livelihood. Symptoms of anxiety and depression are common reactions for people in context of COVID-19. Mental health and psychosocial support should be made available to all workers. Comprehensive risk assessment can help identify and mitigate related occupational hazards for mental health. While returning to the workplace, we should have these things to keep in mind. First, thermal screening at the workplace. Second, wearing a mask at the workplace. Third, maintaining social distancing at least of 1 meter. There should be fresh, clean air in our workplaces. Increased ventilation should be there through natural or artificial ventilation. This is a photographs which shows what are the various measures can be taken at the workplaces what we have discussed previously. These are the various references from where the content has been taken. Students, let's see some multiple choice questions regarding our topic. The first question: coronavirus disease or COVID-19 is an infectious disease caused by a newly discovered virus. The options are SARS-CoV-1, SARS-CoV-2, SARS-CoV-2, SARS-CoV-3 or SARS-CoV-4. So, the correct answer is SARS-CoV-2. COVID-19 is genetically a SARS-CoV-2 virus. Let's see the next question. The virus that causes COVID-19 and the one that caused the outbreak of severe acute respiratory syndrome SARS in 2003 are related to each other genetically. Is this statement true or false? The statement is true. Though COVID-19 and SARS are genetically similar, but the diseases they cause are quite different. Come to the next question. The best way to prevent and slow down transmission of COVID-19 virus is A. Well informed about the COVID-19 virus, washing your hands or using sanitizer, frequently not touching your face, or all of the above. The correct answer is all of the above. The best way to prevent and slow down the transmission of COVID-19 virus is all of the above things, like well informed about the COVID-19 virus, washing hands or using sanitizer, or not touching your face. Next question. Arogya Setu app is an Indian COVID-19 mobile application not used for thermal screening, contact tracing, syndromic mapping, or self assessment. The correct answer is thermal screening. The Arogya Setu app is mostly for contact tracing of the patients, syndromic mapping, and self assessment of a person if he or she is having COVID symptoms. Coming to the next question. Jobs or tasks with close, frequent contact with the general public or others at workplace comes in which risk of exposure of COVID-19. Either it comes in low risk or medium risk, high risk or very high risk. The correct answer is medium risk. The jobs or tasks with close contact where the distance of 1 meter is not maintained comes in medium risk. The next question, the risk of contracting COVID 19 in the workplace depends upon the following, except likelihood of coming within 1 meter of others, frequent physical contact with people who may be infected with COVID 19, contact with contaminated surfaces and objects, or work from home. The correct answer is work from home. The risk of contracting COVID 19 in the workplace mostly depends upon likelihood of coming within 1 meter of the others or contact with contaminated surfaces and objects with COVID 19 virus. Coming to the last question, how much sufficient space WHO recommends for every worker at workplace? The options are 10 meter square, 100 meter square, 50 meter square, or 30 meter square. The correct answer is 10 meter square. WHO recommends minimum 10 meter square space for worker at workplace. So at last, before concluding this topic, I will tell COVID-19 pandemic can be prevented through various preventive measures which we can follow. So stay safe and stay healthy. Thank you.